So, hello everybody. I'm Valerie from France. I worked at Alpha National Vet School as an hospital practitioner, and my daily practice consists in GI diseases since at least 25 years. I would like to tell you that I'm very happy to meet you today, and I thank Nestle Purina to invite me because I feel you must be very proud of yourself in those conditions, and you must know that French people think a lot about you. So let's go on with the first slide. So today we're going to talk about diarrhea in dogs and cats, and we'll talk about definitions. We'll see what are the different causes of diarrhea. We'll meet with the very important steps in consultation, the history, the clinical examination. We'll see what very exams are needed for the important diagnostic workup, how to optimize the therapeutic approach, and we'll talk a little bit about nutrition, and we'll talk a little bit about some particular diseases that can be encountered in consultation. So diarrhea in dogs and cats, as you know, is a very, very frequent consultation complaint for the owners, and it's a daily complaint, and it's characterized by very soft and more important stools. When it's frequent and it evolves for more than 3 weeks, it's characterized as a chronic diarrhea. The cat is not a little dog in gastroenterology, and it's very different, and it's a very particular species, and we're going to talk about that later. Diarrhea can be from time to time intermittent, and when it's intermittent and when it comes back from time to time, it's characterized too as a chronic diarrhea. Sometimes diarrhea may be very recent. You know that about puppies with parvovirus, for example. And sometimes it's not a viral condition, but have a look on the right to Ice. Ice is a female staffy. She is 3 years old. She only shows a diarrhea since 12 days, but she already lost 8 kilos. So in this context, diarrhea is not characterized as a chronic one. It is still a recent and acute one, but it is very urgent to characterize this condition because, as you see on the slide, Ice is really has lost too much weight, and it is an emergency now to understand what happens. When we have a look to characterize the diarrhea, particularly in dogs, you have two different conditions. The first one is the small bowel diarrhea, and the second one on the right is the colon diarrhea. When you have a poor condition in the dog, very liquid stools with a poor color, like blank stools. When you have steatorrhea, like lipids in the stools, or when you have digested blood in the stools, when you have an important quantity of stools, and not so much episodes per day, it's a characteristic of small bowel diarrhea. The other clinical signs that can be seen are rumbling, halitosis, vomiting, polyphagia, flatulences, abdominal distension. The dogs who show this type of diarrhea can be German Shepherd with chronic dysbiosis, for example. It can be too protein-losing enteropathy with a very dilated abdomen, So it can be very important conditions and very frequent cases. When we have a colonic diarrhea, usually the dog is in a good condition, excepting with granulomatous colitis. And you can see on the right of the slide a boxer dog showing bloody stools. And this dog is very young, he's under 2 years old, but he lost a lot of weight. He's in a real poor condition because it's a very severe colitis. Usually, dogs with a colitis are still in good condition, and they show stools not so liquid than the other case. We can have some mucus in the stools, some hematochezia, fresh blood on the stools, and from time to time some solid mucus, as you can see at the bottom of the slide, with stools with around them a very solid mucus pellicule. Usually, when a dog shows a colitis, he needs to go for stools a few times a day, sometimes from 3 to 8 times a day, sometimes more than 10 times a day. So the frequency is very high, and other clinical signs may include tenesmus, very strong pain when stools are produced, from time to time vomiting, and anal dysfunction. On this video, you can have a look to this French bulldog showing a dyschezia, and this dog probably has a colonic problem. On the video of the Dachshund, we can see a very liquid small bowel diarrhea, and just on the right, we can see flattened stools, which are in an abnormal shape, and when the owner describes stools with an abnormal shape, they have to bring the dog into consultation, and we have to have a look into the colon. So globally, you can have just a little blood showed just around or at the end of the stools, and they are due to a little polyps which can be observed and which can be operated after the colonoscopy. On the video on the right, we can see a very important inflammation of the colon, and we can see a typical lesion just now with a colonic mass which was found in a very young boxer who was only 3 years old. So is it very severe? Are some cases of colonic diarrhea very severe? So they are very severe, as I told you, if we have a colonic invasion by Escherichia coli, which are characteristic of granulomatous ileocolitis in dogs. And the most predisposed breeds are boxers, French bulldogs, English bulldogs, and Mastiff, for example. It can be Boston Terriers too. And before the scientific community understood that it was a bacterial invasion, those dogs were put under corticosteroids and died previously, perhaps 30 years ago. And now we know that they need antibiotics. So we have a strong genetic susceptibility. And as you can see on the video, we can have a look to those very important ulcers inside all the colonic mucosa, particularly on the top of the colon. And it's a very painful disease and a very strong general condition alteration is observed when you have this disease. No treatment excepting antibiotics can treat this disease, and at least an hypoalbuminemia is possible, and histopathologic diagnostic includes the coloration with Schiff acid periodic coloration. So as I told you, this disease is characterized by very in-depth in the mucosa of bacteria, which has Escherichia coli. And the first line treatment includes fluoroquinolones administration over 8 to 10 days from time to time. And the first molecule could be enrofloxacin. When you have a digestive disease, dogs can show very different clinical signs in addition to vomiting, diarrhea, or regurgitation. Some dogs show an abdominal pain with this particular position. It's the prior dog. They can eat a lot of grass. Sometimes they are very prostrated and they seem very sad. Sometimes they eat something indigestible, like something on the ground, and they are licking the ground and very strong attitudes. And some show halitosis and they lose their appetite. All those signs have to be recorded because they are very important to know. And when you ask the owner for the history, you must ask a lot of questions about those different signs. Let's talk particularly about what makes the cat a different species from the dog. A lot of cats show chronic diarrhea, as you know, and it can be very strong to treat and to diagnose. So, contrary to dogs, it's much more complicated to localize anatomically the origin of the diarrhea, because the cats particularly frequently show an ileocolitis or an enterocolitis, which mixed lesions in the small bowel and in the colon. That's why it's much more complicated. From time to time, you can have chronic colitis with hematochezia, and it's strongly lesions located in the colon, but very frequently they mixed the two types of lesions. A lot of clinical signs can be associated in cats with intestinal lesions, as vomiting, weight loss, dysarexia, and sometimes as they go outside for the stools, the owners don't know that the cat has a chronic diarrhea. Another particularity of the cat is when they lost their appetite, they have a very strange attitude with the owner, and they can ask for food and go away when the owner shows the food. So it's normal, it just means that the cat shows anorexia. A lot of interactions can explain the pathogenesis of chronic enteropathies in dogs and cats, particularly the age, the intestinal barrier, the environment, the diet, the own immunity of the animal, which can evolve according the years and the time. Food intolerance, as you know, diet has a very strong impact, particularly in GI diseases in dogs and cats, infectious agents, genetic predispositions, breeding conditions, environmental stress, and the quality of the microbiota, as you may know, because it's a very actual topic. As you may know, a lot of breeds show genetic predispositions to different digestive diseases. For example, Irish setters are known to perhaps show a gluten intolerance, which is not so proved than that. German Shepherds have a lot of digestive troubles, notably diarrhea-responsive enteropathies, chronic enteropathies, chronic pancreatic insufficiency, a lot of things. Basenji, but it's not a frequent breed in Europe. Some other breeds. I don't know if you have a lot of Yorkshire Terriers, but they show a lot of diseases too, particularly perhaps from time to time very strong forms of protein-losing enteropathy. And they show frequently colitis. You have Sharpes, which show a lot of disease in GI consultation. And particularly, if you can do it, it's very important to perform in gastroenterology on all your animals, but I don't know if it's available in Ukraine, but it should be good to make the dosage of cobalamin, which is vitamin B12, as you may know. The boxer, as we said already, and the French bulldog are also problematic breeds. So now we just have to answer a few questions just to know how to perform our diagnostic workup. So we have mainly three important questions. The first one is can this disease have a metabolic cause? And if it's no, and we'll talk about that later, which is the localization of the lesion, including liver and pancreas. And what is the nature of the lesion? Is it an inflammatory lesion or is it a neoplastic lesion? Then we have to have a complete history just to know if some elements are important to guide us to the diagnosis. Then we have to perform a very precise clinical examination. We have to find some general signs associated to the major complaint. And then we will exclude the metabolic causes of chronic diarrhea with CBC and a biochemistry panel, and if possible, a cobalamin dosage, as I mentioned above. Then other examination and other laboratory tests will be necessary, like in cats, T4, total T4 dosage. We will have to look for immunosuppressive diseases like FIV. We will have to dose, if it's possible, the pancreatitis specific lipase, etc., according to the clinical condition of the animal. And then, according to what we feel, we can have to perform either plain radiograph. Much more better in GI disease will be abdominal ultrasonography, and if it's possible, either endoscopy or laparotomy if it's needed. During ultrasonographic examination, some fine needle aspiration of abnormal tissues can be performed and can help to guide us on the final diagnosis. Then here we talk about a paper written by Julien Andrieux a few years ago. I think it was 2013, but I'm not sure. And is just to know that there is very often a strong discordance between your suspicion and the results of the biopsies. So they decided to submit a new classification of chronic enteropathies in dogs according to the clinical response. First, under this scheme, we have to know that intestinal parasites and food intolerance represent more than 90% of digestive clinical signs in young dogs showing a good condition under 3 years old. So if you have a young dog and a young cat in a very good clinical condition without any abnormality at clinical examination, you can quite be sure that in more than 90% of the case, it will be either a problem of diet intolerance or a parasitic disease, including giardia and including in cats, Trichomonas fetus. Then let's have a look to the classification. The more important part of these classifications includes food-responsive enteropathies. And globally, the dog or the cat will be better with either a novel protein source or with a hydrolyzed new diet. The problem in that case is that generally you have animals in good conditions. The response is generally very quick and efficient, but you don't know at the beginning how many trials you are going to perform to have the final answer. And in some animals, in my experience, you can have to try from 3 to 6 different diets to have a clinical response. The second category are the antibiotic responsive enteropathies. Here we talk about either secondary dysbiosis due to another disease, we'll talk about that later, or to primary dysbiosis in German Shepherds, for example, which is quite frequent because of genetic events and genetic alterations in those breeds, which have been highlighted in many publications. The third category consists in immunoresponsive chronic enteropathies, and those categories are mainly either protein-losing enteropathies, eosinophilic enteropathies, strong lymphoplasmacytic enteropathies, plasmacytic infiltration enteropathies, the disease who need at least 1 to 2 different immunosuppressants. And the higher category is refractory enteropathies, which are non-responsive enteropathies. In this little category, we will find some inexplicated diseases in dogs and cats. Then we have to know what may be the different causes of diarrhea. As I told you, metabolic disorders can lead to diarrhea in dogs and cats, but at what moment could occur the diarrhea? Because when you have a chronic renal disease, the digestive clinical signs may occur very late at the very late stage of the disease. And if you have a cat exhibiting a chronic kidney disease like iris 2 or iris 1, iris 2 or iris 3, you have very low chances that the digestive clinical signs are explained by the chronic kidney disease. So you have to look for another cause, even if the cat has a CKD stage 2, for example, When you have a diabetes, it has to be a decompensated diabetes and not a primary simple diabetes to exhibit clinical signs. Other endocrine diseases can produce clinical signs, and very frequently we don't have the reflex to think about Addison disease, and it's if you can do it in Ukraine with your analyzer in your clinic, please perform the dosage of basal cortisol just to rule out any Addison disease, because Addison disease can be atypical, and it can be explained by a dog showing anorexia, hypovolemia, vomiting with blood, and diarrhea with blood. And sometimes it's not very characteristic compared with what you read in the books. So don't hesitate to perform the dosage of basal cortisol. Then you have peridigestive diseases like hepatopathies, which are from time to time liver disease, which are from time to time very unexpected. You have a 4 years old dog in your consultation, and then you feel it's a dog without any severe disease. And when you perform the analysis, you find a very mess in the liver. So be careful, because from time to time it's not so easy to suspect a chronic liver disease in dogs and cats. In cats, the major problem with liver disease are two types. The first one is cholangitis, which can be acute and life-threatening condition in cats, and it can be too lipidosis if the cat lost too much weight, for example, because of another disease, probably. You can have young, small animals like Yorkshire Terrier showing a portosystemic shunt, which is not so characteristic in the clinical signs. So if you can do it too, please perform the dosage of biliary acids just to check there is no portosystemic abnormality. Gastrointestinal disease can include pancreatic disease too, like exocrine pancreatic insufficiency, notably in German Shepherd or in collies, and the cats can often show associated with cholangitis, pancreatitis, which can be acute and chronic. Acute pancreatitis is much more frequent in dogs than in cats, and chronic pancreatitis is quite frequent in cats and can be strong to suspect. And then the last category are purely digestive diseases, which include infectious disease, knowing that primary bacterial enteropathies are very rare. So don't give antibiotics if you are not sure it's strictly necessary. Then you have a lot of viruses and protozoa like Giardia, Trichomonas fetus, and another very strong disease, which is Strongyloides stercoralis. And it's a disease very particular because it's a refractory enterocolitis affecting young dogs and showing mild hypoalbuminemia. So if you have a refractory diarrhea in a young dog, please have a look to the microscope to the stools just to see if you see some larvae moving in the stools directly. Then I told you you'll have food intolerance, which is probably the first problem. In some studies, it has been shown that food intolerance all cases included, could represent about 60% of the diarrhea in dogs. Then we have inflammatory diseases, as we talked about previously, including lymphoplasmatic enteritis, eosinophilic enteritis, and protein-losing enteropathies. And at least we have neoplasia, which are much more lymphoma in cats and perhaps much more carcinoma in dogs. It depends on the digestive segment you think about. So what are we going to do when we receive in consultation a dog and a cat with a strong diarrhea? First, the different causes we just talked about may represent what you have in your brain, and you don't need that practically to work. Then, the objectives you have to reach are that after the history, the proper description of the clinical signs, you have to know the aspect, the frequency, and the color of the stools. In this particular context, after a very precise clinical examination, you have to have thought about the main suspicions that showed by this animal and not another. So it will be different if the animal is 2 months old than if he's 10 years old, if he lives with other animals, if he is not vaccinated. So you have really to think about all what is shown by this history and this particular animal to understand the prior hypothesis to think about. So the main points of the consultation will be to understand if the animal can live with a lot of other ones, just to rule out parasitic diseases or very contagious disease like viruses, parvovirus in dogs and cats, for example. In a very young animal, you will think firstly about infectious and food problems, including congenital problems too, because if a young dog shows regurgitation at weaning, you will think about, for example, a mega esophagus. Then you'll have to ask for previous complementary examinations to understand what analyses were performed previously and to interpret the results and to see what treatments were previously administered to the animal. Then it can be very important to have a look directly to the animal in your room, moving, just having a look to the alertness of the animal, the hydration, and a very good examination of the mucous membranes. You know, this dog was coming for an endoscopy, and over the clinical examination, I just saw he showed a mild icterus, so it changed my orientation, and I asked for an abdominal ultrasound first. Then the abdominal palpation in gastroenterology is very important, as well as the examination of the anal margin. Then you have, at this point, to identify the very urgent situations, because if it's necessary, you have to keep the dog or the cat hospitalized. So just now, we are going to have a look to the different categories of investigations and to have a look to the pros and cons of each category. And we're going to see that, as I told you before, according to the context, to the animal, to his history, the things will be different from one to another. So the first important thing to explore the chronic enteropathies are a fecal analysis performed on 3 successful sampling over 48 to 72 hours to identify giardia, because if you perform a snap test which is positive, you know that you have giardia, but if it's negative, you can have giardia because of intermittent excretion, as you may know. Then after fecal examination, you will have a complete blood count and a biochemistry panel with the folate and B12, I told you. CPL can be necessary, TLI can be necessary if you suspect a chronic pancreatic insufficiency, and basal cortisol is needed in some cases. In gastroenterology, radiographies are very useful for esophagus and colon, but not so much for the other organs. If you have a chronic pancreatitis, if you have a cholangitis, if you have even a lymphoma, a diffuse lymphoma, you won't see anything with radiograph. It can be interesting for big foreign bodies, but from time to time you are not able on a plain radiograph to identify a foreign body in the abdomen. So please be careful with radiographs, because it shows not a good sensitivity in GI diseases. Then a very important examination will be abdominal ultrasound. It's a very essential step of your work. So please, if you can, perform those investigations in dogs and cats. And then, according to what you saw during the abdominal ultrasound, you will decide either to go to endoscopy if it's possible for you, or to laparotomy. It depends on what you suspected. Let's talk for a while, about giardiosis. So here you have some cysts of giardiosis, and it's a refractory diarrhea. Very often it's quite difficult to erase, and it's much more in young dogs than in later adults. The dogs often have been in a community of animals, and the better treatment could be fenbendazole at the dosage of 50 mg per kg per day for, from time to time, 10 to 20 days. And then it's necessary in strong infections to use a local treatment with a chlorhexidine, a shampoo, at least 3 times a week, to take the poops and to put disinfectant agent to erase with the quaternary ammonium to erase the parasites. And it's the best thing to do to be able to finally win this difficult disease. But what we may not know is that in some dogs, a strong antigenic stimulation over the months when they got a giardiasis may lead to a oral tolerance rupture, and then those dogs are going to develop probably a food intolerance. That's why diet is so important, because, at the beginning, the dog could eat whatever he wants, and then after this chronic giardiosis, it's not possible, and you have to select the appropriate diet to be able to stabilize the animal. A very particular disease, I talked to you about this a few minutes ago, is strongyloidosis. So I don't know why vets are not, even in France, are not very aware of this condition. And it's very particular because if you don't identify the parasites, the dog will die. So have a look to this white Swiss shepherd he was only 6 months and 16 kilos and showed a very strong diarrhea, permanent, liquid, 3 times a day, a beginning of general condition alteration, loss of appetite, and a very strong weight loss too, recently. So the plain radiographs of the thorax showed bronchopneumopathy, probably because he had vomited. And then the complete blood count showed eosinophilic leukocytosis, evoking parasitic disease, and a mild anemia. Then the biochemistry panel showed a low albumin dosage, and previous coproscopy, including Giardia and PCR parvovirus and coronavirus, were negative. A lot of treatments had been suggested for this dog because he had received all you can imagine, and by the end we seen this parasite directly in the stools with the microscope, and we have to know that if fembendazole can use a little bit, the appropriate treatments includes ivermectin per os, so by mouth, and you have to check if the dog is not MDR1 mutant, because otherwise he will die with this treatment. So you have to be very careful before administering ivermectin per os. If you want other information about that, please send me an email. Then you have this disease. It's the same dog. Look, he had lost a lot of weight. He's very thin, too much thin. And the differentials included pancreatitis, a chronic intussusception, an Addison disease, a chronic pancreatic insufficiency, a chronic eosinophilic enteritis, or a protein-losing enteropathies. So we finally diagnosed strongyloidosis, and we could treat the dog for a few days, and after 7 days, he was definitely cured, which is very important. So here we talk about dysbiosis, and we have the first breed all over the world, I feel, with the chronic dysbiosis is German Shepherd. German Shepherd may show a lot of things, and but dysbiosis in those dogs can be primary. In contrary, dysbiosis is usually secondary to another disease, which can be a partial chronic obstruction, like intestinal neoplasia, a stenosis post-inflammatory or post-neoplastic, intussusception, or some chronic lesions of the intestinal mucosa, including food intolerance, inflammatory enteropathies, or different pathogens. So let's come back to the German Shepherd, which is known, as you can see on this slide, a lot of scientific papers talked about that, and we know that those dogs lack immunoglobulin, local immunoglobulin on the GI tract, and they show a polymorphism of the toll-like receptors that conduce to chronic overload bacterial charge in the GI tract and lead to a secondary dysbiosis. So probably German Shepherds show genetic susceptibility to E. coli, and some other bacteria can be identified in the GI tract. the problem with a suspected dysbiosis, which can be highlighted by the dosage of B12 and folates, can be the secondary dysbiosis, which are not suspected. Let's have a look to this young, not so young Shar-Pei. So this Shar-Pei, as you can see, is not so kind, of course, and as usually Shar-Peis, unfortunately. And then this dog shows a chronic small bowel diarrhea evolving for more than 1 year, responding very perfectly to metronidazole. And the dog is a male, is 12, is in a good general condition, and he lost a little bit of weight, but not so much. And he still eats normally, and he shows a very uncomfortable abdominal palpation, but is not so kind and not so easy to perform this clinical examination. So I'm not sure if it's because he is not very kind, or if he shows a real abdominal pain. So the owner comes to see me, telling me, I gave metronidazole to my dog over the last 12 months. Should I go on all lifelong, or what should I do? Because when I give this drug, my dog is totally normal, but when I stop, the diarrhea comes back. And you know, we performed an abdominal sonography, and we saw, but we didn't understand why at the beginning, a slight stenosis, but very slight, in the middle of the jejunum. And as I suspected that this was a secondary dysbiosis due to this restriction, we immediately performed an enterectomy, and then a partial enterectomy, of course, and then we put the surgical sample for analysis and histologic analysis. Surprisingly, it was a jejunal adenocarcinoma. It was a very localized lesion with not any metastasis, but you know, this diarrhea was exclusively due to the local, very slight stenosis in the middle of an abdominal loop. So it's very important to think that these bioses are very often secondary to another problem and not primarily idiopathic, excepting in German Shepherd. So what are we going to do to enrich our database and to understand what happens to this animal? First, we can perform blood tests. Blood tests are usually normal, but you have to explain to the owner that they are necessary to have an overall important view of the situation. So CBC and extensive biochemistry panel. When you perform that analysis, you will look to leukocytosis, loss of leukocytes, anemia, hyperproteinemia, hypoalbuminemia, renal insufficiency, lipase, pancreatic lipase elevation, etc., etc. It's not because the blood tests are normal that you don't have something very severe or a life-threatening condition. You can have a digestive cancer with not any blood modification. Then electrolytes panel is needed, and particularly in cats, as you may know, which show vomiting and diarrhea, the potassium is very often too low, and you have to restore the kaliemia of this animal. Very important too, as I mentioned before, the dosage of folates and cobalamin. because when they are missing, you don't see anything when you have a look to the animal. And on the contrary, it's very important not to be too low in cobalamin serum dosage. Urine analysis. So as I mentioned before, if you have a senior, an elderly animal like a dog or a cat, in the standard overview of your database, you will need a urine analysis just to check that the gravity is normal and you don't have any urinary tract infection. We mentioned previously the fecal analysis and its particularity, which is that you have to repeat the samples to be sure that you don't have some protozoa. So what are the imaging techniques that we can use to much more understand what is the problem? As I told you, abdominal X-ray shows a poor sensitivity in chronic diarrhea in dogs and cats. I show you the interesting imaging that I had a few years ago with a male golden retriever. He was 14 years old and he showed a chronic intermittent diarrhea, and he had lost 50% of his total weight because he had lost 14 kilos over the last 6 months. So what are we seeing in this picture? We just see a very strong abnormal image in the caudal abdomen of the dog. And can you imagine that this dog had ingested the bath costume of his owner on 6 months ago when she was over the sea, and just now the bath costume stayed in this intestinal loop for 6 months. So we could have thought that this type of dog was going to die because we could have found something very severe. It was severe, but the dog survived and it was okay after we removed surgically this problem. Generally speaking, I don't like X-ray for digestive problems because, as I told you, if you have a liver disease, a pancreatic disease, a diffuse condition abnormal in the gut, you won't see anything. X-ray won't tell you anything about the mucosa condition, and it's very difficult. It's very interesting in foreign bodies, and for esophagus and for colon. If you have a cat with an abnormal colon, you can see he has a megacolon, for example, with a survey radiograph. But otherwise, for the middle of the gut tract, it's not very interesting. So let's have a look to this case, which it was Eva. She was 7 months old, a female, and she showed intermittent loss of blood in the stool, in the liquid stool. But when she was taking smecta, diosmectit, it was okay. And she had not a general condition totally okay because she was a little bit too small. And we found finally with ultrasonography a chronic intussusception, which was here probably over the last 4 months. So it can evolve on very long time periods, those types of lesion. So, and the first examination to understand and the first diagnostic workup step to find this lesion is abdominal ultrasonography. So in the next slide, we're going to have a look to what is a normal intestinal loop when you perform an ultrasonography. And then you can have here on the left part the picture, the theoretical picture of the intestine layers, And then here you can find the real images you get when you perform abdominal ultrasonography. Here, this image is totally normal, and you can see that you have regular layers, very well defined, and it's a normal intestinal aspect. Just here, we have very abnormal conditions, and we can perform fine needle aspiration if big lesions are suspected. You can take some bile content in the gallbladder if needed for analysis. And here on the right, we had a dog suffering from loss of appetite, total loss of appetite. And she had just vomited a few times 1 week ago, and then nothing because she didn't want to eat anything. And she had just ingested a very big piece of cotton, and her intestine was totally broken, and there were some at least 10 to 15 holes in the small intestine, and unfortunately, we had to put her asleep during the surgery. We talk about the pros and cons of gastrointestinal endoscopy when chronic diarrhea is suspected. The endoscopy is really interesting, particularly for gastric lesions and colonic lesions. But the disease has to be represented in the mucosa, otherwise you won't have any diagnosis, and the lesion has to be reachable. So endoscopy may lead you to perform mucosal lesions which are reachable of the duodenum, ileum, colon, stomach, esophagus. Intervaginal endoscopy may lead you to diagnose foreign bodies, to perform stenosis dilation, and to remove polyps. So the interest of this technique could be to diagnose, for example, any immunosuppressant responsive enteropathies, lymphoplasmacytic, eosinophilic, protein-losing enteropathies, neoplasia of small bowel or distal bowel, and all colonic lesions. On this slide, we can have a look to what is a small bowel affected by protein-losing enteropathy. And you can see the dilation of the villi and the lacteals within the villi, which are losing in front of us a total amount, a very important amount of lipids, of albumin, and of procoagulative factors. So on these slides, you can see different aspects of different lesions seen by endoscopy. You've already seen the granulomatous colitis. On the second slide, the second video, you have a very strong modified colonic lesion in a dog. On the third, on the right part of the screen, you can have a look to a particular lesion in the colon of a cat, which was an adenomatous lesion at the beginning, but those lesions have to be removed, otherwise you will have a carcinoma in situ and it will give metastasis to this animal. So your samples have to be put on a particular cassette, on a foam, like shown in the picture. On the last two images of the slide on the right, you can see a big polyp which is shown in the anal margin. And on the total right, you can see a stenotic carcinoma in a colonic segment in a cat. So which are the particularities of feline species concerning endoscopy or laparotomy? So on the table on the left, you can have a look to the pros and cons of each technique. The most interesting thing is to know that endoscopy will only concern mucosal lesions, but it's a very simple, quick, and interesting way to perform a diagnosis in gastrointestinal diseases. And as you know, the discharge is very quick, and generally it has to be installed a few hours after the examination. Concerning surgery, you may reach some lesions that can be reachable by endoscopy with a laparotomy, but it needs a very longer time. It allows you to take full thickness biopsies and every different organs. If you have several sampling to perform in the abdominal cavity, like you need a sample of pancreas and intestine and lymph node, you need to characterize the cholangitis in a cat with a chronic enteropathy, so you can perform an endoscopy surgery, to sample the GI tract in these animals. Here you have a scheme of what segments can be reachable by endoscopy or by surgery. I would like to know, and you will write me to say it to me, if you know sclerosing gastrointestinal fibroplasia, eosinophilic sclerosing gastrointestinal fibroplasia in cats. Here, on the right part of the slide, you can have a look to this disease. We published last week a GFMS open report describing a cat showing those types of lesions. So it's in an open access article, so you can get it freely on the website of GFMS open report. And then, I don't know if you know this disease, which is quite recent, and it could be an emerging disease because we had a lot over the 5 past years, and it shows very strong lesions affecting particularly the gastroduodenal segment of the ileocolic segment. On this slide, you can have a look to a gastrointestinal infiltration by a very strong eosinophilic tissue, leading to a so strong fibrosis that the first cases identified with this disease were characterized as extra-appendicular osteosarcomas and were euthanized, which is not appropriate because this disease is totally inflammatory in nature, but we don't know exactly its pathophysiology. So you will have some informations on PubMed, and please have a look. Particularly the first cats with this disease were particularly ragdolls, but we have some Maine Coons and probably big cats and long hair cats, but sometimes it can be any cat, you know. So have a look to this strong disease because it's a very interesting information. So let's talk for a while about how to perform our treatments, because you may know that too much dogs and cats receive either antibiotics or corticosteroids. So we have to know what we do. You all know that treating a cat can be very complicated because those animals are not so easy to treat than dogs. And if it's not necessary, it can be counterproductive from one part, and to another part, it can lead to antibioresistance, which is very strong for human people because it's necessary to prevent antibioresistance in humans. So when we have to treat an animal for a very long-term disease like hypothyroidism, like chronic kidney disease, like chronic infiltrative enteropathies, like, for example, low-grade intestinal T-cell lymphoma, we have to justify our treatment and to think about how to do it and why. So we have to measure the administration period. Is it for a week, a month, for years, for all long life treatment, which can be every day you have animals that you have to treat for all long life treatments. What is the rhythm of administration? Can we give a pill every other day, or sometimes 2 days a week? Or what should we do? And as I told you, we can avoid to give too much antibiotics and corticosteroids if it's not necessary. Antibiotics could lead to very severe colitis, which are pseudomembranous colitis. They can lead to neurologic disorders. You all know about ranitidine and metronidazole. They can lead to strong toxic acute hepatitis, like trimethoprim sulfate, or they can lead to pancreatitis in some cases. And probably, as you may know, and you could all have a look to the ACVIM consensus on pancreatitis in cats. And we all know that on a first approach, probably antibiotics are not needed in pancreatitis. So think about that when we have to install a treatment, particularly if it's a long-term treatment. A study performed by Stefan Unterer at the University of Munich, and Stefan and his team showed that in hemorrhagic gastroenteritis, the need of antibiotic is not proven at all. So if you have a dog in not so bad condition, please avoid antibiotics even in those conditions. What are the pros and cons of corticosteroids? If you give to a young dog even a low dosage for a short time of corticosteroids, you can lead to very strong modification of the shape of the skull. Here you see the muscles have disappeared definitely. So be aware of this problem. And you know that corticosteroids, if they are not needed, can lead to metabolic dermatitis problems, cutaneous problems, hepatic problems, renal abnormalities, and respiratory defects. So the dog begins to have a very strong inspiratory efforts. You can have some muscular and nervous problems, and you will alter its immunity. So, as mentioned before, we have 3 subtypes of enteropathies. The food-responsive enteropathies, the antibiotic-responsive enteropathies, which are probably secondary to another problem you have to diagnose, and immunosuppressant enteropathies. As I mentioned before too, the diagnosis leads to, when you suspect a food-responsive enteropathies, it leads you to prescribe different diet trials, but we don't know how many have to be performed before leading to a response, even if it's the true problem. So, while you take a complete history, and then you can have different subtypes of diet trials, which include hyperdigestible food, hydrolysate testing, fiber-enriched testing, and sometimes naive protein testing. And then, if it's not successful, you can change your strategy, and you can sometimes, after a rupture of oral tolerance, you are obliged from time to time to keep the new diet for at least 3 to 6 months before trying to go back to the previous diet that was given to the animal. So here you have an example of diets installed by Purina, and you have a look to the few benefits about Purina Pro Plan vet diets, gastrointestinal for cats. So those particularities of the diet is to give low residue, to be easy digestible ingredients, to help to reduce the workload of the compromised gut. The second interest could be that we will have a limited number of protein sources, which is very interesting when you have a rupture of the gut barrier, as you know, and it helps to minimize the adverse reaction. The third importance is that they could add probiotic as chicory inulin, which are very important to improve the gut health and particularly the colonic health, the colonic cell health, to lead to a very nice balance in the gut. So it will improve the intestinal health. Some benefits for dogs too, and it shows you that you have in dogs on the EN diet for dogs a low fat level to minimize the fat maldigestion, which can be a frequent question when you have particularly a chronic diarrhea. Medium chain fatty acids are a specific fat source, particularly with coconut oil, which a very easy source for gut absorption. And the third important thing to know is that this diet for dogs will lead to a low residue and to very easily digestible ingredients. Just a few monographies in case of chronic diarrhea in dogs and cats. Here we have a small Burmese kitten, which is a female, and she is 4 years old. And she shows chronic diarrhea since she was adopted. And she has very strong liquid stools, 4 to 5 times a day. She unfortunately defecates out of her litter, over the place where she goes to poo, and she is quite in a good condition, but she can't take too much weight. So in the stool analysis of this cat, we showed trichomonasis and cryptosporidiosis. Very frequently, cryptosporidiosis is secondary to another disease, and you don't have to treat it. So you have to treat trichomonas with ronidazole at the dosage of 30 mg per kg per day for 15 days. And it's very important to give a gastrointestinal and hyperdigestible diet, particularly what was shown previously, like EN diet for cats, to improve quickly the clinical signs. It's a German Shepherd of 22 months showing a liquid diarrhea and then intermittent diarrhea and then permanent diarrhea. Intermittent vomiting, he lost some weight and he eats his stool. Then this dog shows a primary dysbiosis after fecal analysis, blood database, and abdominal ultrasound, which are all normal. So even if the dysbiosis is primary in this dog, the complementation in cobalamin will be essential, as well as a new diet, hyperdigestible or analogenic diet, will be essential to stabilize the animal and to prevent the too frequent prescription of antibiotics. Here we have a French bulldog, female. She is 6 years old. She lives indoor exclusively, and she saw suddenly a liquid diarrhea, intermittent vomiting. She lost 3.8 kilos, and she shows an edema, a peripheral edema. So in the biochemistry panel, we can see a panhypoproteinemia and an hypocobalaminемia, which leads us to diagnose a protein-losing enteropathies after having excluded hepatic causes and urinary loss of proteins. And then ultrasonography and endoscopy, as we saw the video a few minutes ago, shows us a characteristic images of protein-losing enteropathy and particularly lymphangiectasia. So this dog had received previously some corticosteroid, and in this case, we were obliged to associate two immunosuppressant molecules, which will be corticosteroids and cyclosporine. If a rescue protocol is needed, we can, as published before, and it's an open access publication, you can find the use of chlorambucil as a rescue protocol when you have a strong protein-losing enteropathy, which can be very refractory. Here we have a male European cat who was 11.5 years old and is presenting with vomiting, anorexia, sometimes polyphagia. He lost 800 grams over the last 6 months. He is diagnosed previously with a chronic knee disease iris 2, stage 2, with non-proteinuric problems, and his dosage, his cobalamin serum dosage is under 150 nanograms per liter. So he is submitted after ultrasonographic abdominal examination to per endoscopic digestive endoscopy and biopsies. And we have diagnosed a low-grade T-cell intestinal lymphoma showing a very strong hypo B12. So we have to give him B12 either by injection or by oral supplementation. And then we give corticosteroids and chlorambucil. We have 3 different protocols to treat this problem, and it's very well tolerated globally, and we have an overall median survival time which can be more than 2 or 3 years. And it is important in those circumstances to prescribe a good gastrointestinal diet, which is constantly given by the owners. So how to diagnose an inflammatory condition and to differentiate this inflammatory condition from a low-grade intestinal T-cell lymphoma. It's not so easy, and you have no clinical specificity for those dogs. And particularly, the age is important because you can't suspect generally a low-grade intestinal lymphoma under 8 years old. So if the cat is 4 to 5, you have very low risk to find low-grade intestinal T-cell lymphoma. The clinical sign can evolve very inconstantly, can be permanent, and sometimes you have cats showing very strong condition to eat. Then, what are we going to tell you about the low-grade intestinal T-cell lymphoma? It's an indolent disease, very indolent and not aggressive one. It's concerned, as I told you, elderly animals from 8. It's an emerging disease defined by probably having multiplied by 6 to 10 over the last 20 years. And it's a very important disease, both to clinicians and pathologists. We showed over the last year that probably there was a continuum between inflammatory and low-grade intestinal T-cell lymphoma. Then what is important to know about those two diseases? First, the indication and the limits of each of the examination and the diagnostic workup have to be known. So each cat has to be completely explored with a complete blood count, a cobalamin dosage. You have to exclude hypothyroidism. You have to exclude all the comorbidities like chronic kidney disease, like cholangitis, pancreatitis. You have to try to understand what is the global pattern of the cat. And then before biopsies, it's very strong to know if you have an inflammatory or a low-grade intestinal T-cell lymphoma. So ultrasonography is helpful because if you have thickened jejunal lymph nodes, you can think that you have probably more a lymphoma than in inflammatory conditions. If the cat is under 8, you can only perform endoscopy to understand what happens and to sample the digestive tract. If the cat is over 8, you have to perform jejunal ileal biopsies by surgery if you have a strong suspicion. The gold standard to perform the diagnosis is the histopathology and the immunohistochemistry. So if you have an exchange with your laboratory, you will just try to characterize the lesion with the pathologist and understand what is the final diagnosis. So it's very important to talk with the pathologist to understand what happens. You can perform too cytologist sampling, but I have to know that if you perform cytology on fine needle aspiration on the jejunal lymph node, you will never know if it's neoplastic or if it's inflammatory. If we talk about low-grade lymphoma, there is no difference between the two entities on cytology. And then clonality must not allow you to reclassify any case. The gold standard is definitely immunohistochemistry. On this slide, you have a flow chart to understand a diagram, to understand how to go on, to understand what are the clinical signs and what are the different steps of diagnostic workup. So please have a look and feel free to ask some questions if needed. So I think it's okay for us today. I just want to thank you for your invitation. I will always be here if you need me. And once again, I'm very impressed by your courage and your tenacity. And I think we have to admire you because it's incredible what you live over the last 2 years. So be strong and don't hesitate to come back to us if you need anything. Bye-bye.